If you want to know the difference between a patient with intensive care at home and a patient that's staying in intensive care long term, stay tuned because I have news for you today. My name is Patrick Hutzel from intensivecareathome.com, and I will explain to you the difference today between a patient with intensive care at home and a patient that's stuck in ICU, in an ICU bed long term. So let's dive right into it. This week I was actually traveling. I met clients and staff in Brisbane. We had our Brisbane networking event. As part of that, there's a video from our Brisbane networking event on YouTube on my channel as well that you can watch. In any case, I was actually meeting one of our clients in Brisbane who's got muscular dystrophy and he's got a tracheostomy and he's ventilated. Now, he was stuck in an ICU bed for months on end before we finally took him home with intensive care at home, right? So what's the difference between being stuck in intensive care and going home with intensive care at home? Well, I'm glad you've asked. So first off, let me start with this. This gentleman now being at home, he can actually work from home. Now, he's working with a computer, right? And he's very skilled man that works for a government authority, right? And he contributes to society. Now, he couldn't do that while he was in ICU, right? So, I mean, I've worked in critical care nursing for 25 years in 3 different countries. I've been setting up intensive care at home way back when in Germany. I was part of it anyway. I've been setting it up here in Australia, intensive care at home. And we've been changing many, many lives as part of intensive care at home, where we send critical care nurses into the home for long-term ventilated adults and children with tracheostomies. And we're replicating an ICU bed in the community. We're providing a genuine alternative to a long-term stay in intensive care at home. So in ICU, people are stuck in a bed space with no natural daylight, right? With no fresh air, with no quality of life in essence. And people are being hospitalized, they're being institutionalized. Whereas, compare this with intensive care at home, where we send critical care nurses into the home 24 hours a day to replicate the ICU bed in someone's own home, where they can have actually quality of life. They can have natural daylight. They can have family coming and going when they want, not when the hospital wants, right? With limited visiting hours and all that sort of nonsense, right? Whereas at home, the client is in control. At home, also, the client controls their routine. The client controls what they have done when, right? In a hospital, it's the hospital's way or the highway, right? That is not holistic and it's not person-centric. What's the difference again with intensive care at home? It's person-centric. It's holistic. It is driven by the clients, not by the hospital, right? As humans, we want to be in control. By giving back that control to the clients, to our clients, and maximizing their quality of life. That is what clients want. And hospitals want, ICUs want an empty bed. It's a win-win situation. But carrying on, what else is different? Well, all of our clients, without exception, have community access. Compare that to an ICU bed where people can't think outside of their little ICU bed, where it's difficult to get someone, outside of the ICU, because ICUs can't think outside of their little boxes, right? It's difficult even to get someone, outside in their bed, in a chair to mobilize them. Whereas at home, it's very different. Our clients get mobilized, they go into the community every day, right? And it's all possible because they're critical care nurses 24 hours a day at home, right? And that, by the way, cuts the cost of an intensive care bed by 50%. It's win-win altogether. It's a win-win situation on all levels. Now, next, if our clients at home need input from medical teams, well, that can all be done via telehealth, right? No need for expensive and extensive ward rounds, especially when someone is stuck in ICU long term, right? Not much is going to change anyway, right? And at home, that can all be done virtually, right? It's 2024, coming close to 2025. People in ICU need to wake up of what's possible, right? You need to embrace new concepts. You need to embrace new thinking. And most importantly, you need to embrace holistic thinking, patient-centric thinking, family-centric thinking, right? It helps you and your ICU, but more importantly, it helps the families, the patients and the families. Isn't that why we're in nursing, why we're in medicine? To help patients and their families, to get the best outcomes for them? Well, that's definitely what we are doing at Intensive Care at Home, right? Clearly, just with that comparison between intensive care at home and a long-term intensive care patient. So, families already embracing it, because I know if you're a family watching this, you go like, yeah, of course, that all makes sense. You might have your loved one in ICU in a situation like that, and you're thinking, oh, that makes a lot of sense. That makes a lot more sense than the approach in a hospital. Then I encourage you to reach out to us anyway. But even, if you're an ICU doctor, ICU nurse, hospital executive watching this, you think, yeah, that makes sense. Then I also encourage you to reach out to us here at intensivecareathome.com. You can find us at intensivecareathome.com. You can call us on one of the numbers on the top of our website, or you can email us to info@intensivecareathome.com. Now, with Intensive Care at Home, we are providing a genuine alternative to a long-term stay in intensive care. And we've sent critical care nurses into the home 24 hours a day. And we're providing quality care for hospitals, for patients, for families, for intensive care units, right? We're also providing services for tracheostomy clients without ventilation, for BiPAP, CPAP ventilation without a tracheostomy. We're providing home TPN, home IV potassium infusions, home IV magnesium infusions, home IV antibiotics, Hickman's central line, PICC line, Hickman's line, as well as port management at home. We're also providing ventilation, weaning, and palliative care at home, right? With Intensive Care at Home, we are currently operating all around Australia in all major capital cities, as well as in all regional and rural areas. We are an NDIS approved service provider all around Australia. We are TAC approved and WorkSafe approved in Victoria, iCare in New South Wales, NIISQ in Queensland, DVA all around the country. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. We are the only service provider in 2024 that has achieved third-party accreditation for intensive care at home nursing. We have achieved that accreditation, that level of accreditation, since 2012. No other provider has therefore created the amount of intellectual intensive care at home property or intensive care at home nursing property than we have. We are therefore also in a position to employ hundreds of years of critical care nursing experience in the community combined. We are therefore the only service provider that actually provides evidence-based and accredited care in the community. Check out our mechanical home ventilation guidelines on our website at intensivecareathome.com. And those mechanical home ventilation guidelines are evidence-based, and they clearly say that only critical care nurses with a minimum of 2 years critical care nursing experience are safe to look after ventilated plus minus tracheostomy clients at home, adults and children. Now, if you're stuck in ICU and you're listening to this and you think, oh yeah, that makes a lot of sense, or if your family member is stuck in ICU long-term and you want intensive care at home, please reach out to us. We can help you get your loved one home. And once again, if you're watching this, if you're an ICU professional, doctor, nurse, allied health, and you're watching this and you're thinking, yep, that makes a lot of sense, and it does, hello, contact us at intensivecareathome.com, call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. And if you're at home already and you realize that you are set up at home on a ventilator, tracheostomy, BiPAP, CPAP, home TPN, whatever the case may be, and you realize that your setup is not working, it's probably dangerous because you don't have critical care nurses 24 hours a day, I encourage you to reach out to us as well. We can help you with more funding, we can help you with nursing, and I can tell you, we would not be in business if we couldn't help our clients with funding and with the advocacy, right? Because we keep our clients at home predictably. Clients without critical care nurses 24 hours a day on ventilation, tracheostomy, or even on tracheostomy without ventilation have died because support workers or even general registered nurses without ICU experience could not manage ventilation and tracheostomy. People have died. It takes years of training for critical care registered nurses to be competent in ventilation and tracheostomy. It cannot be done without intensive care nursing experience. Our first client over 10 years ago had a support worker model, and he was never at home because they couldn't keep him at home. As soon as we started working with a client, he never, ever went back to ICU. Quite simple, very simple. Our concept is actually very simple, right? We're sending critical care nurses 24 hours a day, and clients are at home predictably. They no longer live in an ICU bed. So that's also why we are providing level 2 and level 3 NDI support coordination. We're also providing TAC case management in Victoria and WorkSafe case management in Victoria. Once again, helping our clients with the right level of funding for intensive care at home. And if you're an NDI support coordinator watching this and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for more nursing care for your participants and you don't know how to go about it and what evidence to provide, I encourage you to reach out to us. We can help you with the advocacy and with the evidence. We provide NDI specialist nursing assessments as well, done by our critical care nurses, and some of them have a legal nurse consulting background. And if you are a critical care nurse and you're watching this and you're looking for a career change, we're currently offering jobs for critical care nurses in the home in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo in Victoria, in Warragul in Victoria, and in Geelong in Victoria. If you have worked in critical care for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted to hear from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients want to have the same staff coming over and over again because they are so vulnerable and so special. It's all about building critical and crucial relationships with our clients and with our other team members. And therefore, we want regular and stable teams. That means if you're looking for agency work where you can come and go, this is probably not the right fit for you because our clients want and need regular and the same staff coming over and over again. It's all about building relationships and nurturing them. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We are currently expanding our medical team as well. We can help you eliminate bed blocks in your ICU and ED for your long-term patients or for your regularly readmitting patients in your ICUs and EDs. With our critical care nursing team at home, we are here to help you to take the pressure off your ICU and ED beds. In most cases, you won't even pay for it. But even if you do pay for it, we cut the cost of an ICU bed by 50%. We're saving roughly $2,000 per ED admission. And also, we have much success with sending our CCRNs into the home care environment to avoid ED admissions. And we have done so successfully for the Western Sydney Local Area Health District for their In Touch program, where we've sent our CCRNs into the home to avoid ED admissions and provided an emergency department bypass service successfully. And if you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.